In this video, we're testing our diagnostic skills. Here's how it'll work. I'll present you with a fictional case. Then you'll take some time to figure out what you think the most appropriate diagnosis is. At the end, I'll tell you the correct diagnosis. Let's take a look at the Case of Jules. But first, my name is Keegan. I have a master's degree in counseling and I'm a licensed professional clinical counselor. Keep in mind that engaging with this channel does not constitute a therapist-client relationship. This content is for educational and entertainment purposes. This does not substitute or replace professional mental health care. The patient, Julian Vane, or Jules for short, is a 31-year-old male who presents to an outpatient clinic for a psychological evaluation. His evaluation was initiated following recent legal involvement. Jules arrived around 5 minutes late for his appointment. He was dressed in high-end, formal attire, which he reported was from a business associate. During the interview, he demonstrated distinct compulsive behaviors, at times interrupting the clinician to arrange items on the clinician's desk into a rigid, parallel alignment. He stated that this is similar to behaviors that he does each night before he goes to bed, where he perfectly aligns his shoes before he can go to sleep. The clinician inquired into a variety of mental health symptoms, including those related to anxiety, depression, mania, and trauma, but these were all largely unremarkable. Jules does report compulsive behaviors. However, the clinician noted that his description of these were overall quite vague and seemed somewhat surface level. He also denied any distinct obsessions. He does report some difficulty with sleeping and says that this is often because he stays up late gambling and finds that his online gambling is so exciting for him that it's then difficult for him to fall asleep or get his mind off of the gambling that he was doing. He does report some symptoms of anxiety. However, he struggled to identify any specific symptoms that trigger his anxiety, and his report was overall subclinical for any anxiety diagnosis. Jules reports having previously been diagnosed with ADHD in his childhood and continues to endorse symptoms that are consistent with this diagnosis. This includes difficulty sustaining attention, being hyperactive, often being late, experiencing impulsivity, making careless mistakes, and being forgetful. When asked about his childhood, Jules reports that he was a troublemaker. He says that he was never in any legal trouble until now, but says that he was often scolded at home and school for his behavior. He said that he would bully others, he stole quite a few times, and would even start important things on fire for the fun of it. He said that he was a loner in school and was not liked by other kids. The clinician noted that Jules did not seem to be overly bothered by not having friends and being on his own in childhood. He notes that he currently continues to not have many friends. When asked what prevents him from having more friendships, he said that he does not seem to really desire as much connection as others do. He adds that when he does have friends, they often tell him that he's cold and that he can come off as uncaring. He says that they then tend to drift away out of his life. Jules was asked to share an example of a time that a friend drifted away like this and what occurred. He gave the example of a time where he borrowed money from a friend and that the friend then accused him of stealing the money. With prompting, Jules elaborated on the story. He said that he had been at the friend's house and that the friend had money sitting on their kitchen table. When he saw the money, he says that he took it with the intent of returning it to his friend. He states that he was in a financial pinch and was needing money, and the friend obviously didn't need the money, otherwise they wouldn't have been so careless by leaving it on the table. He says that since they had been so careless just to leave it sitting there, he didn't see any harm in borrowing it since he was intending to pay it back. He says that when the friend realized that he had borrowed the money, they became very upset, accused him of stealing it, and didn't really talk to him much after that. After hearing this story, the clinician reiterated to Jules that he had not previously been in legal trouble from what he had said, but they were wondering if he had committed other crimes that he hadn't been caught doing or hadn't been charged with. After hearing this question, the clinician noted that Jules smirked and said that laws are open to interpretation and that he had maybe done a couple of things that could have gotten him in trouble had he been caught. The clinician then asked Jules about his work history. He says that he's currently unemployed and that this has been the case for him for a while. He went on to say that he didn't really see much of a point in working. When asked to expand on this, Jules says that people are always willing to help out or forgive a debt as long as you can say just the right thing to them. The clinician then asked Jules to expand on this further. Jules says that if you give people a good sob story, it's not too hard to find a person, a church, or some program that will help you pay for things. He remarks that it's amazing how many people will give you money if they find out you have cancer. When asked if he's been diagnosed with cancer, Jules remarks that he hasn't, unless he has a bill or two that's needing to be paid. Jules says that he's been evicted once or twice. The clinician asked Jules about his family. He says that his family lives in another state and that he doesn't really talk to them. When asked what led him to move away from his family, He says that he had a legal charge in the state where they live that caused him to move away. He continues that he couldn't be bothered going to court for this legal charge as it was so minor and silly that he didn't see a purpose in it, and says that he instead decided to move away. Jules never expanded on what the legal charge was, but instead kept saying that it was so minor and small that he said it was dumb that they even had a law about it. Jules presented to session well-groomed in formal attire. His physical appearance presented as consistent with his chronological age. His behavior towards staff presented as cooperative. However, he contradicted himself and appeared to be dishonest in some of his responses. He appeared relaxed and calm and had a demeanor that was even charming at times. He did not seem to struggle with maintaining his attention or being overly active, but he did say that he had taken his ADHD medication prior to the session. His mood was reported as being euthymic, and his affect was overall consistent with this. That said, there were brief moments during the interview that Jules appeared to be more irritated. Let's recap the case and then talk about the diagnosis. But first, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing. To recap, Jules is a 31-year-old male. He presents for evaluation following a recent legal interaction. He initially said that this was the first time he had any legal interactions or charges, but did later admit to breaking the law on other occasions and having previously been charged with crimes. With many of his legal charges, he was very vague with the details and overall unwilling to share many details related to them. He did acknowledge fleeing the state following one of his crimes. Jules reports being unemployed currently and having a spotty history with work. He also reports being evicted. He states that he's able to pay for his bills by telling people that he has cancer or giving them other stories that will make them feel bad for him and give him money. He reports having previously been diagnosed with ADHD and does take medication for this. He does report some symptoms of anxiety, but these are overall very minimal. He denies most other mental health symptoms related to depression, mania, or trauma. Jules does say that he has some difficulty with sleep, but says that this is often due to gambling that he does before he goes to bed. Jules presented to session wearing high-end formal attire, which he said was from a business associate. However, the clinician notes that this is odd, given that he says that he's unemployed and has not had a stable work history. If you need more time, pause here before we move on to what the diagnosis is. Based on what Jules reports and his interactions in session, he meets criteria for antisocial personality disorder. And if you want to learn more about antisocial personality disorder, make sure you subscribe as we'll be diving into this diagnosis in the next video. This is the end of the fictional Case of Jules. This case presentation is for entertainment and educational purposes. Any resemblance that this case has to a real situation is purely coincidence. That brings us to the end of this video. I hope that you found it helpful. While you're here, make sure that you check out some of the other videos on my channel. Thank you so much for watching.